Hey there, health warriors. When caring for patients with Alzheimer's or dementia, safety goes beyond medications and meal plans. It includes preventing them from wandering or eloping from care facilities, which can quickly turn into a life-threatening emergency. Today we're talking about elopement prevention in healthcare. What it is, who's at risk, how to spot early warning signs, and what your team can do to keep vulnerable patients safe. Let's get into it. Elopement occurs when a patient who is cognitively impaired leaves a healthcare setting without staff awareness or permission, putting themselves at risk of injury, exposure, or even death. Most at risk are patients with Alzheimer's disease, dementia, delirium, traumatic brain injuries, and autism spectrum disorders in some pediatric settings. Elopement is not just wandering, it's unsupervised exiting, which can trigger missing patient emergencies. Why elopement is so dangerous? Elopement can lead to falls or traffic accidents, hypothermia or dehydration, assault or exploitation, delays in treatment and deterioration, regulatory action or liability for the facility. One missed moment could become a tragedy. Prevention is everything. Common triggers for elopement. Patients may elope due to confusion and disorientation, desire to go home or find a loved one, fear, overstimulation or noise, pain or unmet needs, for example, toileting, hunger, routine-seeking behaviors or past habits. Watch for warning signs like restlessness or pacing, repeated attempts to open doors talking about leaving or going to work, increased agitation at certain times of day, for example, sundowning and fixating on exits or staff routines. So, how to prevent elopement? First, perform a risk assessment. On admission, screen for history of wandering or cognitive impairment. Use tools like the Wandering Risk Assessment or Morse Fall Scale. Second, use environmental controls. Lock or alarm exit doors in dementia units. Use wander guards, tracking devices, or alert systems. Remove visual cues for exit doors, for example, disguising doors with murals or curtains. Ensure staff-only areas are clearly secured. Third, maintain supervision and routines. Assign high-risk patients to visible areas. Provide structured daily activities and sensory stimulation. Use purposeful redirection when patients appear restless. Fourth, train all staff on elopement protocol. Every team member, from housekeeping to clinical, should know how to identify risks and respond. Conduct regular drills on missing patient protocols. Lastly, communicate clearly in handoffs. Use care plans, shift reports, and room signage to highlight elopement risks. Document behaviors and interventions consistently. Now, what to do if elopement happens? First, activate facility protocol. Announce a code yellow or code gray, depending on your facility. Notify security and initiate the search plan. Check exit doors, stairwells, and outdoors. Have staff search assigned zones quickly. Review surveillance if available. Notify emergency contacts and authorities. Call 911 if the patient is not located promptly. Alert the patient's family or POA. Complete incident reporting and debrief. Document what happened and contributing factors. Update the patient's care plan and safety measures. Meet with staff to review and strengthen protocols. Always remember, prevention is key, but response can save lives. Elopement may only take seconds, but its impact can last a lifetime. By staying alert, working as a team, and prioritizing prevention, we can protect some of our most vulnerable patients and give families peace of mind. What strategies does your facility use to prevent elopement? Drop your best tips in the comments. We're all in this together. Like this video? Give it a thumbs up. Subscribe for more safety training, dementia care tools, and healthcare best practices.